Hello, my name is Sivan Cook Ojo, and this is North Central University's assignment for MFT 6102, Week 5, where we are to develop a diagnosis and differential alternative rule out diagnoses for, we had a choice of three different biographical movies for three different people, and to substantiate our diagnoses that we develop with evidence from their lives, and then compare four different treatment options. So I decided my choice of person was Sylvia Plath. And just right now, I'm just going to give like a little brief synopsis of Sylvia Plath's life so that we can follow along here a little easier together. Also, I would like to apologize in advance for the constant looking down as I am referring to my notes. I have many notes, so I want to apologize in advance. So Sylvia Plath, was born October 27th, 1932, and took her own life February 11th, 1963, at the age of 30. She was an American poet, novelist, and short story writer, and born in Boston, and she studied at a number of universities and colleges. She married a fellow poet, and they lived together in both United States and England for some time. They had two children, a girl named Frida and a boy named Nicholas. And Mrs. Plath, Sylvia, was was already diagnosed clinically depressed, and for most of her adult life, and was treated at the time, or in that time, treated with electroconvulsive therapy treatments. With electroconvulsive therapy. She then, as I stated earlier, committed suicide in 1963. Now, before I go into my specific diagnoses for Sylvia, I just wanted to mention some things that kind of piqued my attention in regards to Sylvia's life after reading the bio on Wikipedia, and also after finding the movie and watching the movie. There were some things in her life that kind of interest me in being possible stressors or risk factors that probably exacerbated her depression. First off, and she states this in the movie, Sylvia had a very close relationship with her father. It's not stated in Wikipedia or on the movie how close their relationship was, but what is piqued in the movie is that she states in the movie that her life was together prior to 9 years old. At 9 years old, Sylvia lost her father. So the death of her father occurred at age 9. So that was one thing that I noted. Another thing also is that during her marriage, well, I'm sorry, let me back up before I start talking marriage. She's a writer, poet, short stories. She started basically on this field or this career path at a really early age. One thing that I also noted in the movie was that Sylvia's mother was very I don't want to say she wasn't a loving mother, but I could tell that she had a lot of expectations, that she put a lot of expectations on Sylvia, and it was like, you have to succeed. Also, they noted in the Wikipedia information that she had a high IQ. Another thing that I noted in the movie is that she was like very concerned with what others thought of her. But I know that when you're a poet and you're a writer, most of your career basically depends upon the critics, what the critics are going to say about your work. How they feel or whatever, that kind of sort of makes you or breaks you. And so Sylvia I noted again that she like had this thing where she just was very concerned about what the critics were saying, what her mother thought, all of these different things, and she just, I think she kind of gleaned from positivity, those positive, because we all do, we all glean and all feel a certain way, we want those positive stimulus from people, from our loved ones, from community, all of that. And that made a really big difference. So these types of things I took note of as I'm doing this diagnosis, as I'm looking at these treatments, these type of things I took note with Sylvia. My diagnosis, which honestly was I was back and forth with it, and when I get into it, you'll understand what I mean by back and forth. My diagnosis for Sylvia was persistent depressive disorder with intermediate major depressive episodes with current episode and moderate anxious distress. One of the things that I was having some problem with was, the difference in the major, the major and persistent depressive disorders, because the only thing that really sort of divides them the most as it related to Sylvia was the length of time of the disturbance. In the major, when you look at the major depressive disorders, they talk about the symptoms as being a part of the person's life for a good 8 weeks, no less than 8 weeks, and that's that. Okay, and then the movie did not exactly help much in showing, like, I really had to go back and forth between the movie and the actual Wikipedia information, because the movie was not as fluent with her life as the Wikipedia information. The Wikipedia information definitely gave me clue to the fact that Sylvia's disturbance and Sylvia's depression had been occurring, these symptoms have been occurring for longer than 8 weeks. She's been dealing with this, as Wikipedia stated, most of her adult life. But when you watch the movie, it kind of does not reveal it in such a way. It just kind of minutes it down. The movie starts when she meets her husband, at the time of meeting her husband, whereas all the stuff, her parent dying, or even the fact that she attempted suicide early on, a couple of times early on, none of that is in the movie. So it's like very, you have to really go back and forth to get the whole gist or the whole picture of Sylvia. But it's very obvious from the Wikipedia information that she's been dealing with this longer than 8 weeks. And so that is why I gave her a diagnosis of persistent depressive disorder, because the criteria A for persistent depressive disorder states that you must be in depressed mood for most of the day, for most of the day, or more or less most of the day, for at least 2 years. And this has to be noticed or verifiable by other people, not just you. Like, other people have to be able to, state, yeah, she's been depressed for 2 years or more. And the symptoms present while depressed, you must have at least two or more of these following symptoms: poor appetite, insomnia, low energy, low self-esteem, poor concentration. All of this stuff, even in the movies, they would show her low energy from time to time. Some insomnia she spoke of in the movie as well. Um, Poor concentration. She was, after she married her husband, there was a lot of time where she just couldn't get it together to sit down and write anything. She was having like a lot of serious writer's block, and her focus was just kind of everywhere. Also, their criteria states for persistent, it states that during the 2 year period of disturbance, the individual has never been without symptoms in criteria A and B for more than 2 months at a time. And this, it was the red flag for me, because if you look at the movie, in the movie, there's a period, and I would call it the courting period between her and her husband for at least a good, I'm not going to say that it was a total year, but it was at least a good 6 months. I can assume, I'm assuming because I'm watching the movie, that this time period was probably at least a good 6 months where she wasn't demonstrating as many. I mean, she always kind of seemed semi, like she'd have moments of, just low energy, no affective happiness or joy. She would have a moment every once in a while, but for a good 6 months almost, that courting first I'm in love honeymoon episode right after her marriage, she was kind of cool. I mean, her mood was a little more joyous than not. So I started really like second guessing my diagnosis until after that 6 months, everything just went south. And to be more specific with you, when she went back to work, after their marriage, they had their little honeymoon stage, and then Sylvia went back to work, actually started teaching at the university, her alma mater, and there was concern that the husband was cheating, that there was a concern of infidelity. When that started, everything just, she was back. All of the symptoms, but that I still could not totally disregard that 6 month hiatus, even though everything crashed and burned right thereafter. It just kind of threw me off. So I honestly could not, I'm like, well, maybe it's not persistent, because she had this period here, but she wasn't exactly hitting all of the, how can I say, she was not actually hitting all of the criteria for major, either, because of that just 8 week time limit of the disturbances. It was just like she's most of her adult life been dealing with this. So disturbances have not just been for 8 weeks. But there are also times in her persistent situation where she has moments of I'm okay, but it's back and forth. So that, that kind of got me with, made it difficult to figure out, what do I rule out? Do I rule out major, or do I rule out persistent? I truly feel, because she is meeting every one of those criteria for persistent, except for criteria C, where she had that good little 6 months of joy, happy right after marrying her husband. That's like the only criteria really that I can see that she's not meeting totally. So I just want to reiterate here. I diagnosed Sylvia persistent depressive disorder because she was dealing with the disturbances for more than 2 years. However, there have been times, as I stated, in Sylvia's life where criteria C, which is the criteria that says you cannot go without these disturbances for more than 2 months, that criteria C has not been true at times, well, at least one that they showed in the movie. So there was, like I said, are plenty of marked instances where Sylvia was totally engulfed by the diagnosis, by the disturbance. I mean, there was just number of times where you could see that, but then there was that one time, and I do know that it was more than 2 months, because from the time she met the husband, the man that would be her husband, to them actually getting married was a good 3 months, and she was pretty much okay. They were showing the dating part. She was good. She was sleeping good. I mean, I actually was watching the movie, like, sort of kind of like waiting for her to do something, like, during that time. But during that time, basically what was being shown was like her, talking to the husband about her past attempts of suicide. But, so I can say that, when movies are made, sometimes they're dead on true to life. There may be sometimes they're not, but based off of what I have seen, and that is her overall diagnosis is so much closer to the persistent than the major. This is why I decided to make it persistent, because these things overall have been happening to her for most of her adult, and I would say they probably started early adolescence, probably late childhood, like right up, like you said, 9 years old. I really believe that was a marked thing that triggered some things within Sylvia's life, including this depression. And I would say from that point on was probably her slope downward. Whether it was caught or not, that, we will never know. Well, from the information, we don't, it wasn't, because the information says for most of her adult life. But like I said, I think that 9-year-old stage, that was important. That was an important stage for her. So I ruled out major as an overall diagnosis, but I did, as I said, put the intermittent, let me So I'm going to read exactly what it states about the specifier of with intermediate major depressive disorder. So it says here, if the it says if the individual's symptoms currently meet full criteria for a major depressive episode, then the specifier of with intermediate major depressive episodes with current episode would be made. And mindly, we have to state that, of course, I have to state at the end, it was very major. And the difference between full criteria of a major versus persistent, on the major criteria list, it speaks of constant death ideation, suicide ideations. And at the end, she was having that. When she was having the problem of feeling her husband was stepping out on her, as I stated, everything sort of went downhill then. Okay, so that is the reason for that diagnosis that I gave her. So now let's talk about treatment finally. Let's get into treatment. So we have 4 different treatments that we will be 4 different types of treatment that we will be comparing and contrasting basically as it relates to the treatment of depression. So let's first start with the psychopharmacological, excuse me, or as I would like to just call them, psychotropic medications. So overall, the most widely used treatment is for depression is antidepressants. According to WebMD, it states that there are a variety of different antidepressants used to treat depression. These antidepressants all work to take away or reduce the symptoms of depression. Your mental professional chooses which antidepressant is best for you based upon your symptoms. So usually you will start at a low dose, and then depending on if you need more, they'll gradually increase based upon your needs. However, the question remains on just how safe antidepressants really are, especially for children and teens. There are some serious concerns that most antidepressants cause suicide or cause a risk of suicidal thinking in children and adolescents. Further, we must also look at the greater goal involved with depression, and that is learning how to just cope. And in order to do that, learning to cope, there is no magic pill for that. Medications, in my opinion, only address the problem on a symptomatic level, and in life there is always uncertainties, and it is necessary, excuse me if I'm fumbling over the words today, it is necessary for those with depression to have appropriate coping skills. So let's move on now to psychological treatment. So another way of describing psychological treatments is to say individual counseling, or others call it talking therapies. In the Yapko's 1999 AAMFT clinical update article on depression, it states that psychotherapy actually outperforms medication in some key areas. These areas include lowering treatment dropout, better social adjustment, lower relapse rates, and greater ability to teach prevention skills. Further, Yapko also adds the importance of marriage and family therapists to advocate for psychotherapy as being a part of a well-constructed plan. So the article basically suggests that it's our job as marriage and family therapists to push for psychotherapy as a part of a treatment plan. BeyondBlue.org, which is an online support webpage for those who are dealing with depression, states that psychological therapies can help change the way we think or your thinking patterns, help to improve coping skills so that you're better equipped to deal with life's stresses and conflicts. Like I just stated, I mean, the pill only stops symptoms. It doesn't really teach you what to do. So there are several types of effective treatments and even different delivery options for these psychological treatments. The different options range from one-to-one counseling, one-on-one counseling, all the way up to in the group environment, or even online therapy, which I found really uniquely weird. Everything is internet now, so I guess it's not that weird, but I don't know. I'm more of a hands-on, I want to see you in my face type person. I don't know about that is really hypocritical considering I'm sitting up here talking to a camera to give my assignment. But I think with the therapy aspect, I don't know. I think I just want to be able to see the person in front of me. But there is the option for e-therapy. However, psychotherapy alone is not always effective in people, especially those with severe depression. Also, according to Health After 50, which is an online health blog, typical psychotherapy takes longer than drug therapy to produce noticeable benefits from the treatment. So, next, let's look at family therapy, a treatment option of family therapy. So, Yapko's same 1999 article states that depression runs in families. Which is true because in the documentations for Sylvia, her son unfortunately ended up with depression and ended up killing himself as well. So it runs in families, and however it runs in families not like we would expect. It's not a genetic factor being passed. It's more environmental than anything. Depression is contagious in a way. The mood and outlook are influential factors that people share in social interactions that can lead to a spreading of positive and negative emotions through interactions. So family therapists are instrumental and can be instrumental in identifying and treating the interactional patterns that could trigger and exacerbate depression and further identify and reduce risk factors for depression in marriage and family. However, as I stated before in the psychotherapy treatment comparison, family therapy alone may not be effective, especially if we're dealing with a severe form of depression. Further, some clients may not wish to reveal deep details of what they are struggling through in front of a group or in front of their family. So that could also be a red flag on that. So finally, let's talk about biomedical treatments. So biomedical treatments focus on reworking the brain functioning by using drugs or electroconvulsive treatments and even psychosurgery. So we've already discussed medicine. So in this review, we're going to briefly talk about electroconvulsive treatment and psychosurgeries. Now, according to the Boundless Psychology section on types of biomedicine biomedical therapy. Electroconvulsive therapy, or ECT, is used for psychiatric disorders that do not respond well to all other treatments. So basically, when we get to these biomedicals, especially the psychosurgery and ECT, we're at a last resort situation. For major depressive disorders, ECT is used after all other treatments have failed, or if we're in an emergency, like there is an immediate suicide situation going on, or suicide ideations are going on. Now, a study done in 2012, according to the Boundless Psychology, states that the effectiveness of ECT on patients with bipolar and unipolar depression was about 51 on overall remission rates, 51% of overall remission rates. However, there are concerns with side effects caused by this treatment, by ECT, which includes nausea, headaches, muscle pains, dental injuries, and and oral lacerations. So things like cuts within the mouth. Which all of these side effects are short-lived, but the bigger concern would be with the much more long-lasting effects, which consist of things like cognitive side effects and transcendent confusion. Even some people have even experienced short-term memory loss because of this. So those things have to be considered as well. Finally, let's talk briefly about psychosurgery. Now, psychosurgery is a procedure aimed at disrupting the neural pathways in your brain. Its use has declined due to better psychiatric medications. Thank the Lord. These treatments include procedures where a physician will get inside the skull and perform literally surgery on your brain. This is not used now because of better treatment options and because it has a low rate of effectiveness related to the rate of risk. So the risk totally outweighs its effectiveness. But it is a biomedical treatment, so I thought I would bring that up and talk about the pros and the cons. Overall, for me, even though this was not asked of this assignment, but I thought I would give it. If I had to pick a treatment for Sylvia, if we had got to her sooner, even in the movie at the end, they last minute gave her medications and sleeping pills, things to, like I said, address the symptoms only. Me personally, I would couple Sylvia's treatment being a type of psychotherapy with medication, both together, because she really needed to learn how to adjust and cope with the things that were happening in her life. That way she could just, get through it. But since, sometimes those symptoms were a little severe, obviously, and when she's having suicidal ideations from time to time, because of that, that's why I'm stating the medication would be necessary to help combat those symptoms and kind of level her out so that she can fully benefit from psychotherapy or even family therapy, because as we stated, there was a possibility that husband was cheating. So my treatment plan would be, as I stated, either psychotherapy or family therapy, probably most likely family therapy because of what was going on in our marriage. And and the psychotropic medications. That is what I would do for Miss Sylvia Plath if she was around. But thank you once again, and this concludes this assignment for Marriage Family Therapy 6102, week 5. I hope you enjoyed. Thank you.